Hey there, and welcome to the Perinatal Pelvic Health Solutions channel. Today, we're diving into a topic that many moms don't hear much about, but is a common source of pelvic floor symptoms after childbirth. For those who don't know me, I'm Dr. Ryan Bailey, a pelvic floor physical therapist and pregnancy and postpartum specialist. What I am talking about is pudendal nerve injury. The pudendal nerve plays a huge role in the health of your pelvic floor. When it gets injured during childbirth, it can lead to symptoms like pelvic pain, incontinence, and even sexual dysfunction. But how do you know if pudendal nerve injury is the root cause of your symptoms? And most importantly, how can you heal from it? The pudendal nerve runs from the sacrum through the pelvis, supplying sensation to key areas like the perineum, the anus, and genitals, and controls muscles involved in bowel and bladder function. When this nerve is stretched or compressed during childbirth, it can result in a wide range of pelvic floor symptoms. The injury can happen if the second stage of labor is very long, if forceps or vacuum are used, or if you give birth to a larger than average baby. These factors increase the pressure on the pelvic floor and in turn put strain on the pudendal nerve. So, what are the telltale signs that your pelvic floor issues might be linked to pudendal nerve injury? Based on current research, the most common symptoms include pelvic pain. This could be a burning, sharp, or tingling sensation around your perineum or lower pelvis. Urinary or fecal incontinence. You might have trouble controlling your bladder or your bowel movements. Painful intercourse. Some women experience a loss of sensation or sharp pain during sex. Numbness, especially in areas supplied by the pudendal nerve, like the perineum, the vagina, or anus. Diagnosing pudendal nerve injury can be challenging because its symptoms often overlap with other types of pelvic floor dysfunction. That's why consulting with a pelvic floor specialist is essential. They can help rule out other causes and perform specific nerve tests. While this diagnosis is primarily based on your symptoms and medical history, you can start by taking an educated guess. Answer the questions in the caption below to assess whether further testing like nerve blocks, MRIs, or nerve conduction tests might be necessary to guide your treatment options. The good news is that your body has a natural ability to heal, even from pudendal nerve injuries. Some studies suggest that waiting until your first postpartum period can help naturally reinnervate the pudendal nerve, reducing or even eliminating symptoms. However, if you prefer not to take a wait and see approach and want to be proactively supporting your recovery, especially to build reserve for future pregnancies or menopausal changes, there are steps you can take to aid the healing process. The key focus here is improving space around the nerve and reducing compression for blood flow to the area affected. This is essential because nerves need adequate blood supply to heal. One of the most effective ways to do this is through specific pelvic floor exercises. Let's talk about some exercises that are specifically designed to open up space around the pudendal nerve and increase circulation to promote healing without stretching the nerve. I'm going to show you them. The first exercise is diaphragmatic breathing. So let's lie on your back with your knees bent. You're going to rest your hands on your ribs so that you can focus on movement through your ribs. You're going to inhale, and as you inhale, try to expand into your back and side ribs. Allowing your belly to be soft, allowing your pelvic floor to be soft. Let's do this 5 times. Last one. Okay, from here, we're going to flip onto our hands and knees. And what we're going to be doing are pelvic tilts with our pelvis, trying to maintain no movement through our upper body. So really all this movement is going to be happening in just our pelvis, okay? So the breathing with this is going to be inhale as your pelvis tips forward, which arches your low back, and then you're going to exhale as you tip your pelvis back, which rounds your low back. Now, again, I am not moving my upper back. It is just my pelvis that is moving, and I am keeping my glutes, my butt muscles, soft. I am not clenching them. If you find that your feet want to come together, just lightly separate them a little bit. And we're doing, again, 5 of these nice and slowly so that you can really focus on just moving your pelvis with your breath and keeping those glute muscles nice and relaxed, not clenching really through any muscle. You're using the least amount of muscle to get this to happen. Okay, then we're going to settle into this neutral position. So we're not sagging, we're not arched, we're in the middle. And from here, you are going to put a block, okay, underneath one knee. Okay, you can see how this tips me. So if I go this way, okay, you can see how I'm raised up on this side. So this can help open up the hip on that side, okay? And so from here, what you're going to do is you're going to sit back into this and then come back up, okay? So you're going to sit back, and this is when I'm going to inhale, and then I'm going to exhale. Inhale, exhale. Inhale, exhale. One more for a total of 5. And then we're going to switch sides. Okay, so now we're going to sit back. You should really be feeling a stretch through your bottom of the side that is up on the block. Sit back into that side. Go for 5 again. Once you've done 5, we're going to move the block out of the way. If you need to kind of just sit back and roll your wrists a little bit, you can do that, or we can keep going. So then from here, we are going to get our glutes involved a little bit, but we're going to start with a very basic move to begin with. You're going to inhale, getting those ribs to expand. And then as you exhale, you're going to slide one leg behind you. Now, we're not lifting your leg quite yet. You're just sliding your leg back. So you're going to inhale, filling those ribs, keeping the belly and pelvic floor soft. And then as you exhale, you're going to stay as stable as possible without clenching through the pelvic floor or the core, but you also want to make sure that you're not pushing your belly out, okay? So then you're going to slide one leg back. But when you're sliding your leg back, you notice that you really lean off to one side, then don't go through the range that you can actually control, okay? So inhale, exhale. Okay. Now, when you're sliding back, you should be feeling that your leg is going back in a straight line, that you aren't turning your leg out. Okay, turning your leg out can actually close around the nerve, and we don't want to do that. So again, 5 of these, and then switch sides. This is the most basic to start with, okay? These can be progressed to lifting your foot off of the floor and even beyond that. But this is a good place to start because especially if you are early in postpartum, we want to make sure that you also have the core control to be able to maintain this position without a lot of wobbling. Okay, from here, we are going to roll onto our back and we're going to be doing a glute bridge. I want you to grab your block again. If you don't have a block, that's totally fine. Should have said this before, but you can also use a towel, paper towel roll, something that you can just put between your knees. So you're going to go wider with your feet, but you don't want to turn your feet out. You want your feet facing the wall opposite you, versus turning out, because you want to feel that you're actually opening up and creating space around your sacrum, which is where the pudendal nerve comes out of. So squeezing the block just to hold it there, but not overly clenching through your inner thighs. So we're going to be lifting on our exhale and doing this without tipping to flatten. You want to just maintain a nice neutral position. So you're going to inhale, expand through your ribs, and you're going to keep the belly and pelvic floor soft. And then as you exhale, you are going to raise your pelvis off of the floor. Okay, your glutes are going to be involved with this to get you off of the floor, but I don't want you clenching and tucking. Okay, we're staying in this nice neutral position. You should actually feel that you've got space around your sacrum, of the back of your pelvis, and that you're really just hinging where your hip, your thigh, back of your thigh meets your pelvis, which is that glute crease right here. And then we're going to lower back down and then lift. Okay, so you should be feeling it much more midline versus out here. Okay, if we feel it a lot out here, that means that you might be actually rotating through those hips and clenching and actually squeezing and compressing the nerve. So we don't want that to happen. We want to get these glutes online and our inner thighs online to help us create more space. 2 more.
Okay, fantastic. So we started off with 5 reps of each. You can go through that whole sequence again to do a second set. And then at the very end, we're going to do a child's pose. So I'm going to show that to you. So when you get into child's pose, try to make sure that your heels are just underneath your sit bones, that your heels aren't to the outside of your sit bones, because again, that actually closes off the bottom portion of our pelvis, and we're trying to open up back there. So you want to make sure that your heels are directly underneath your sit bones. You can go a little wider with the knees if that is more comfortable for you. But still maintain that your thighs aren't rotated out, and that your heels are underneath your sit bones. And then from here, you can either have a pillow underneath your belly, right? So you can do something like this, because really what we're trying to do is we're trying to be in a comfortable, relaxing position versus a position where you feel like you have to hold yourself in or be tense in. And then once you're in this position, what I really want you focusing on is breathing down into your butt. Okay. So as you inhale, I want you to imagine that your sit bones, which are directly underneath your or over your heels right now, are expanding. They're creating space. So your breath is then creating more space and stretching from the inside out. So you're going to inhale and feel the tissues around your anus, between your sit bones, expanding outward. And then when you exhale, they're just softly coming back. We're not contracting them. And then inhale, expanding outward, and then exhale, just gently coming back. Okay? So we're going to end with 5 of those, doing it at your own pace, nice and relaxed. And then when you come out of it, just slowly sit back up so that, again, you're not clenching up and tightening up. Okay. If you have any questions about your symptoms, or if you are curious, again, answer those questions in the caption that I wrote down to see if you need to go and have further testing either by a physical therapist or a doc who does more, can do MRI and nerve blocks and a pain specialist, because we don't want this injury to turn into chronic pudendal neuralgia, which can be really debilitating, and cause a whole host of problems on a higher intensity scale. So if you answer yes to any of those questions, then you can absolutely give this sequence a try just to start to heal yourself. But I would highly recommend you go and see a specialist so that you can then get more individual care and potentially even some manual therapy. Don't forget to follow and share this with anyone who you believe may also have these symptoms so that they can get the care that they deserve.